They're young and full of potential, but there's a threat that can ruin all of that for your operation. It goes by many names: shipping fever, bronchial pneumonia, fibrinous pleuropneumonia, or just plain pneumonia. Whatever you call it, the problem is the same: bovine respiratory disease, and the consequences can be deadly. Bovine respiratory disease, or BRD, is a serious condition for dairy operations. In fact, BRD is the single largest cause of death in weaned heifers and the second most common cause in pre-weaned calves. Even those that recover from the disease can have lasting growth, fertility, and milk production effects. And that can really add up. In fact, it's estimated that BRD costs dairy producers as much as $15 per calf per year. Be ready with fast, effective, and economical ZACTRAN for your non-lactating heifers and calves. How BRD happens. Because of the space occupied by the rumen, the volume of a calf's lung is small compared to its size. It has to use its lungs much more intensively to satisfy its oxygen needs. This reduces its ability to cope with invading pathogens, making it vulnerable to respiratory infection. Since cattle normally carry BRD-causing bacteria in their respiratory system, when their immune system is compromised by stress or viral infection, these opportunistic bacteria can make their way into the lungs. As the bacteria reproduce in the lung, the immune system sends disease-fighting cells to combat the growing infection. The bacteria fight back by releasing endotoxins that cause inflammation and destroy immune cells, which releases even more irritating substances into the lung lining. The irritation, endotoxin excretion, mucus production, and inflammation create lesions and other damage, and the signs of BRD quickly develop, including fever, depression, lowered head, lethargy, not eating enough, nasal discharge, diarrhea, shallow breathing, and coughing. The best way to handle BRD and help ensure calves reach their full potential is to prevent it, starting with vaccinations. Even with vaccination, staying on top of the disease means implementing the right BRD control strategy. Decreasing stress at weaning is one of the biggest management changes you can make to decrease the risk of BRD. Consider removing calves from the dam within 12 to 24 hours to prevent the spread of bacteria to the calf. Also, be observant during the transition from milk to calf starter. Be sure calves are consuming 1 to 2 pounds of calf starter before removing milk from the diet. Also, make sure calves have adequate, clean, fresh water to stimulate calf starter intake and rumen development. Get exactly the right solution for controlling BRD. ZACTRAN has been tested in calves at risk of BRD and approved for BRD control. By working with your veterinarian to determine which calves and heifers are at risk, you can help control BRD in stressed cattle before signs arise and irreversible damage occurs. The active ingredient in ZACTRAN, gamithromycin, is rapidly absorbed and extensively distributed where it's needed, in the lung tissue. In field trials, ZACTRAN significantly decreased the incidence of disease among stressed calves. ZACTRAN is a macrolide, and in the same drug class as Draxxin, they work similarly to control BRD. If signs appear, ZACTRAN is also approved for BRD treatment. In field trials, clinically ill calves given ZACTRAN showed a significant improvement within 24 hours. ZACTRAN continued to work for 10 days. With its economical pricing, ZACTRAN is affordable, offering considerable savings over Draxxin as well as Nuflor. 24-hour response and 10-day control in one easy and economical injection. ZACTRAN, exactly right to help your calves and heifers reach their full potential. Talk to your Merial sales representative or veterinarian about prescription ZACTRAN. For prescribing and other information, call 1-888-637-4251 or visit ZACTRAN.com. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older, or in calves to be processed for veal. The effects of ZACTRAN on bovine reproductive performance, pregnancy, and lactation have not been determined.